All right, right away. I see something with the knees with this gentleman. Uh-oh.
Indeed. And the feet?
Yeah,
Look
they're
at the feet
reverted.
and the
Yeah.
knees.
Yeah. What do you see?
I see an interesting development on the left leg versus the right. There's a difference in tone, the way they structured. One almost looks a little taller than the other, or something. Right where you drew that line, there's some interesting things happening. I'd have to go looking for that. But we can see that this gentleman's feet are very much duck-footed in that sense of, look, we can see his toes, and his left ankle has really collapsed inward. Ah, that must be part of it.
Oh, yeah. Look at that.
It's happening a bit on the right, but we can, in this particular picture, it's happening on both, but this picture shows it more in the right.
Yeah.
That's why he's got really tight outside of the legs, the peroneals.
Yeah.
And so he's bound on the outside. And then his glutes are working really hard to try to balance the leg, right? So it's tight on the outside, then it's tight on the inside, it's tight in the low back, it's tight in the front. And then the shoulders just kind of hope they find a place to land.
Yep. We got a difference in the arm windows. We got shoulders are in disparity. We got a little puppy dog posture. The ears are off. The head is tilted. There's a lot of tilting going on here, a lot of disparity.
This person has the same length legs, correct? Do we know?
Yeah.
Okay. The reason I say that, let's go look at a few of his other pictures. I want to look at that leg again. Can you see that looks like the right hip is high?
Yeah.
Okay. So let's go see if this is real or if it's just the pant
Yeah,
line.
yeah, yeah. Look at that.
Yeah, it looks pretty real. Okay. But then it seems there's a rotation in that. Can you see it? So it's like the right hip's high, but then it's rotating clockwise.
Yeah, you can
Meaning,
see. Yeah, the right hip. Yep.
good job. Yes, excellent.
Yep.
This
And
person is kind of coiled into a little bit of a startle pattern. They're
mm,
tight and they're gripping in some pretty big muscle groups. This person happen to have any anxiety? I don't know. Oh, here we go. I love this line. Okay, check this line out.
mm,
It's not that bad, is it?
not bad at all. He's
However,
also a young man.
well said. This is why get healthy wind before your growth plate's set. Let me repeat that. Get it together before your growth plate's set.
Now we
All
can see
right.
a
So,
rotation because,
yes, sir. There's your rotation.
ooh,
Oof. Right? And it's a really interesting one. And that's why I was asking if the leg was a different length, because it's an, or maybe he's left-handed. Um,
mm,
okay, if you look at this one, if the folks at home are like, what are we looking at? Just observe on this side, the shoulder is behind the line.
yeah,
Pelvis is not so bad. But it's anterior.
mm-hmm,
Right? So before earlier, I had said that pelvis is going clockwise, which means that right hip is generating a twist. And then now let's go look at that other side.
on point, pretty much.
Yeah, so that right one is feeding the left side, right? We're rotating clockwise. If this is 12, 1, 2, 3, 4, 5, 6, right? So that right hip's coming back. It's giving us what appears to be correct orientation on the left. However, his left shoulder is still behind the line.
Right. And but if we look up here, we can see
Yes, well done.
the difference because look at the left hand. The left hand is practically on his thigh, which means
Mhm,
his shoulder is totally rotated.
mhm.
And the right one is it. I mean, it's not perfect, but it's better.
Exactly. So let's go down to, or just open it big again so we can look at him for a minute. So I assume this gentleman is, I don't know, he looks about 5 foot something, not excessively tall.
Mm-hmm.
I always mention height because we do live in a world in America. So again, I don't know, you mentioned this person might be over in another country.
Yeah, he's in India.
Really, it's
Yeah.
in India. Okay.
Yeah.
I really, really respect the fact that you also need to look at where people live in their natural environment, right? So certain cultures squat more. Yay. Just saying, more cultures, especially India and Asia and Africa, like basically the people who can squat and sustain that and then stand back up and then go back down. What happens if you've got some health issues or maybe something's going on? Because like you said, he's young, but he's got some stuff going on. He has a kind of a low tone, like somebody who might have been bedridden or sitting and waiting to get better.
Mm.
Because what's tight in him is muscles that are tight from sitting. That's all I'm really going to say a lot about. His hips are tight, they're twisted, they're playing through his feet and his head. And he's trying really hard to open up his chest with his low back.
Some creases up here in the neck too.
Mm-hmm. His shoulders are pulling him.
Yeah.
So, I mean, if that's hard to do, think about that old thing where if you're standing, stick your feet out, stand there, let your head go forward. Then he probably feels that and says, oh, that's not right. So he pulls his head back, squeezes his shoulders, lifts his chest, and then he rotates a little bit. So he hasn't found the lift from the inside out.
Right.
And yeah, so like here, can you see my screen?
No, we can, yeah. Let's go
Right.
inside the body. Show me something. Let's go
Go
inside.
inside the body and the function of said body.
Yeah.
Because the gentleman we're looking at, his knees are not tracking very well over his ankle. Can you see my
Mm.
little guy?
Yeah.
Okay, so, and we already saw that, right? We were like, oh my goodness, his ankles were just falling in, right? He was like, "Brr."
Yeah, his left ankle is bad.
So if the ankle's not working straight away, the knee's not going to align correctly into the hip. So that gentleman right here, I would say, hey, go grab a stick, a broom handle, a rod from a store, anything, something long and strong. And I would have them put that on the sacrum, right? We can have a lumbar curve, but the shoulders, he would need to work that shoulder girdle to pull it back and that head. So this is a great exercise for people to really start to think about. When my head is not over my hips where it needs to be, so there's posture and function, you must take posture into function, right? The sacrum. So these three, boom, head, ribs, pelvis, spine, primary for all movement. You've got to be able to keep this through movement until, of course, your knees come way up high till your belly button, and then this will stretch out. But what we're seeing here is that this gentleman can't even stand up on this line, right? He goes, whoop, and he twists. So when people are like, how can I help myself? Getting in tune with what are your habits? Do you tilt your pelvis? You know, we talked about this group. Do you have the ability to fill this space in with muscles, right? So all of you guys who are really keen on the flat belly, you've lost your bootay. You need these hips. You need these hips right here. You need these hips. So why do I point all this stuff out? Our gentleman we're looking at, his knees are falling in, which is a telltale that he's weak. And we really need to help him out. He's probably got really tight hamstrings too. But I'm just trying to get people to understand that this pelvis needs to be able to do what we call cats and dogs, or move posterior, anterior. So watch what they're going to do to this girl. They're going to say, this is no bueno. So we're going to bend the knee to engage the ankles, to strengthen the feet. All right, so a downward dog doesn't mean hang out. You can use a downward dog to get strong. And because this man's in India, this might be a really interesting conversation because it's more cultural.
Right.
You know what, you know, I can't say it in Sanskrit, but you know, Uttanasana and downward dog, upward dog, sun salutation. These are practical and certain. And here again, head forward position, stick this person in a chair, Kevin. Look at your computer all day or your phone right here.
It's for the
So,
people.
yeah.
It's for the people.
Right. So it's for the people. You're so cute.
Sacrifice.
But this is what we're talking about. So that gentleman if I send him a protocol, we're going to start working on hands and knees. We're going to start using a rod or retraining his body
Right.
to realize
Yeah.
that he's got some imbalances. How do I get out? Stop share. Why do I want to show that? Because not only are we teaching you guys, we want you to also understand. It's not just here, take this, here, do that. That's why you've got some coaches here. We want you to understand you're not broken. There's some just really basic gravity principles and health principles that the body needs to have to sustain on our planet because of gravity.
Yeah. We're just going from uncorrect to correct. That's it.
Yeah. We're going from, we don't even want the word neutral. We want the word natural. We want you to get back to natural, where you were before you got civilized and grown up and got a job.
Yeah, and Coach Amber reported to me that this gentleman is not doing well. He's in his 20s, and so he would be a perfect candidate for our Peace Over Pain 120 program because
Mhm.
he needs the nutrition, he needs the posture, he needs the whole enchilada. And so, that's what we're here for. And if anyone out there wants a P-Ray, we do offer these for free. And just go to peaceoverpain.com, and there's a button there, and you can order one for free.